My name is Ruth Ceannt. I'm one of the SPRs currently working in the NIO. So I'm just going to share my screen now and hopefully others will join us. And if there's any questions, you can put them in the chat box. And then Cría from the NIO will be speaking after me. If you can't see my screen being shared, please put it in the chat box and Leanne, one of the other hosts, will be able to see that and hopefully let me know. Okay, thanks, Aparna. I saw that you can see my screen there. So as I said, my name is Ruth Ceannt. I'm a specialist registrar in public health medicine, currently working in the NIO. Today I'm going to be presenting on vaccine hesitancy, and I'm also just going to give a little talk about a paper I was involved in on COVID-19 vaccine hesitancy in parents a number of years ago as well. But just to start with vaccine hesitancy in general. The objectives of this session are to understand what vaccine hesitancy is, to understand why some people are vaccine hesitant and the different components of vaccine hesitancy, to take a closer look at COVID-19 vaccine hesitancy in parents, so that paper that I just referred to, and hopefully to gain an insight into how to address vaccine hesitancy. What is vaccine hesitancy? WHO defined vaccine hesitancy as a delay in the acceptance or refusal of vaccination despite availability of vaccination services. Vaccine hesitancy is complex and context specific. It varies across time, place, and vaccines, and it is influenced by factors such as complacency, convenience, and confidence. So I'm going to come back to those 3 C's a little bit later and just go into a little bit more detail on them. The vaccine hesitancy is dynamic. A person may accept one vaccine, but not another vaccine. They might accept a vaccine at one time, but not at a different time, or perhaps in one context, but not at a different context, such as if they're going abroad, but not if they're staying at home. Vaccine hesitant people do not form a heterogeneous group, and there are many factors at play. There are many different reasons that a person may be vaccine hesitant. Why is vaccine hesitancy important? WHO identified vaccine hesitancy as one of the top 10 global health threats. As hesitancy increases, vaccine uptake can decrease, and this can impact on the re-emergence of infectious diseases that have been kept at bay by vaccination, sometimes for years or decades. This is a threat at both an individual level and also at a population level for herd immunity. As some vaccines require a very high level of uptake in order to maintain herd immunity and effective control of the disease. And measles is just one example of this, where 95% population uptake of the vaccine is required in order to keep the disease under control. Herd immunity is important to protect those in the herd that cannot be vaccinated. So some people with certain conditions can't be vaccinated. So the rest of us need to be vaccinated in order to protect ourselves, but also those who don't have that opportunity to be vaccinated. So any small uptake in vaccine hesitancy, even by just a couple of percentage points, and therefore decrease in the uptake, can have effects at a population level. This is why it is essential to maintain confidence in vaccines. The fact that some people are vaccine hesitant is probably a good sign that vaccines have worked so well that people no longer fear the diseases they protect against. And they are so rare that people don't remember their devastating effects. This, of course, creates its own problems. As mentioned above, if vaccine hesitancy increases, so will the diseases that vaccines protect against. This can currently be seen in real time with the re-emergence of diseases such as recent measles outbreaks in various parts of the world, including in Europe, and the last one in Ireland, I think, was in 2018. And also the threat of polio re-emerging as well, as some sporadic cases have been noted in the Western world as well. There are some rather worrying findings contained in a report published last week by UNICEF that confidence in vaccines is slipping globally. The public perception of the importance of vaccines for children declined during the COVID-19 pandemic in 52 out of the 55 countries studied, including in Ireland. And in Ireland, in this UNICEF report, the perception of the importance of childhood vaccination fell 6 percentage points, from 91.5% to 85.5%. And just those few percentage points could really impact on the control of these diseases. Those under the age of 35 showed a greater reduction in confidence, and as did males. And pre-COVID, Ireland's vaccine hesitancy rates were 31st out of the 55 countries compared in the UNICEF report, but post-COVID, we're now at 17th in terms of vaccine hesitancy, so we've moved up quite a bit. The ECDC, the European Centre for Disease Control, has also recently warned about the potential for rising measles outbreaks in Europe, and even for the re-emergence of polio. So in a recent report by the ECDC, it was mentioned that in the EU, EEA, 2.4 million children may be under-vaccinated for polio, which is quite alarming. A recent paper from Japan also demonstrates the potentially tragic effects of vaccine hesitancy. So HPV vaccination began in 2010 in Japan for girls aged between 12 and 16, and initial coverage was quite high at 70%, but this dropped to 1% due to hesitancy related to now disproven concerns regarding the vaccine side effects. However, when this paper was published, I think in 2020, though the concerns had been disproven, the rate hadn't gone back up. It had hovered still around 1%. And this paper used modelling to estimate rates of cancer and deaths. And just to quote from the paper, because it just gives quite a stark example, the vaccine crisis from 2013 to 2019 is predicted to result in an additional 24,600 to 27,300 cases, and between 5,000 and 5,700 deaths over the lifetime of cohorts born between 1994 and 2007. And this is because of the 1% rate. If those people had, as the vaccination rates had remained at around 70%, 5,000 to 6,000 deaths would have been averted. Why are some people vaccine hesitant? So back to those 3 C's mentioned earlier: complacency, convenience, and confidence. Complacency. This is when people are not particularly worried about the risks, or maybe they're just not aware of the level of the risk, or how bad these diseases, infectious diseases, are and what risk they pose. They perceive the risk to be low. They're complacent about it. They might think things like, it won't affect me, we live in a safe part of the world, or my children don't need a measles vaccine, sure, there's no measles here. So vaccination is not seen as a high priority compared to life's other competing interests. Convenience. This is when the logistics of getting the vaccine outweigh the perceived benefit for the person. So they see it as difficult to access. It might involve traveling to the clinic, time off work, language barriers, other inconveniences. And the person believes it is just too inconvenient to get the vaccine, not weighing up how inconvenient it might be to get the disease, to say the least. Though in Ireland, we do actually make the vaccines quite convenient compared to some other countries, particularly it being free of charge for childhood vaccines, and that's actually not the case in all countries. So we do make them quite convenient comparatively. Confidence, perhaps the most complex of the factors and the most relevant following the COVID-19 pandemic. A person may lack confidence that the vaccine is safe, effective, or necessary. And getting a vaccine, I think, involves a big leap of faith in some ways. It involves trusting in many different people, institutions, and factors. So getting a vaccine involves trust and confidence in policymakers, politicians, and government, your health system, your healthcare worker, doctors, nurses, pharmacists, scientists and experts, health professionals in general, the media, and yourself. Do I know who to trust? Do I know what sources are reliable? And do I know how to make sense of all the information available? And actually, that's all very hard, and we're not always all very good at that. When you think about it this way, it is understandable that some people are vaccine hesitant, and that it is becoming more prevalent now in the age of mass media, the internet, and social media. Navigating the online world and the scientific evidence available, or non-scientific evidence, is difficult. Most education systems do not teach critical thinking skills and scientific reasoning, even though maybe they should, and it would be very useful. So who is vaccine hesitant? Lots of people are vaccine hesitant, lots of different types of people from all walks of life. It's not just conspiracy theorists, which is a narrative that kind of emerged with the COVID-19 pandemic. These are just a very small minority. Vaccine hesitancy is a spectrum from downright refusal of all vaccines, sometimes termed vaccine resistance, to just requiring reassurance about some vaccines. This is good news because it means that it may be possible to educate most vaccine hesitant people, those that are maybe more the middle ground, and to increase vaccine uptake in these groups. And remember that many people who are vaccine hesitant have genuine concerns that, once addressed, may persuade them to get themselves or their children vaccinated. It's natural for people to worry about their own health and about vaccinating themselves or their children. Just to delve a little bit deeper into the spectrum of vaccine hesitancy, there's those, as I said, on one far corner that refuse all vaccines with conviction. They might be termed vaccine hesitant. Then there's ones on the other end of the spectrum who accept all vaccines with confidence. And then there's those in the hesitant group that may have questions. And there's a range within that hesitant group as well. So there's those who are more towards accepting, but they're unsure. There's those who accept some, delay some vaccines and refuse some. And then there's those who refuse but are unsure. And what influences a person's decision to vaccinate? As mentioned above a few times, it's very complex. And there's multiple influences that act on a person to make them decide whether to get vaccinated or not, or whether to get their children vaccinated or not. These include public health and vaccination policies, both globally and at a national level, subjective norms in your society or culture, risk perception and trust, communication in the media, and that's the mass media and social media included, knowledge of vaccines and health concerns, perceived importance of vaccination, health professionals' recommendations, and past experience, either of vaccination for yourself, past health experiences, or related to other people in your circles, or religious and moral convictions. Data, evidence, and science certainly play a part in people's decisions to vaccinate, but in reality, people are sometimes more often influenced by other factors too, such as anecdotal evidence, lived experiences, and emotions. And none of us are completely rational beings. Sometimes we tend to see what we believe, and rather than believing what we see. So taking all this into account, how we deliver our messages is just as important as what these messages are. Is vaccine hesitancy increasing? Yes, it is. It is hard to quantify the rates of vaccine hesitancy. It's not a routinely collected piece of data, and it's complex. However, we know it is increasing from population-based surveys and from the proxy measure of falling vaccination rates in some cases. This is due to a number of factors. And some of this list comes from a short article I read while I was researching this presentation that I'll direct you to. It's called The Vaccine Hesitant Moment, and it's published in the New England Journal of Medicine. I'll come back to it later to recommend it, but it's a short read and it's definitely well worth reading. So some of the factors that are involved in increasing vaccine hesitancy include a culture of decreased trust in experts, the rise of the internet and social media, a rise in belief-based extremism, or probably more accurately, a wider dissemination of belief-based extremism through the internet and social media, political polarization, libertarian views, alternative healthcare advocacy, and bad science, such as the MMR vaccine and autism link drawn in the Wakefield paper. And many new vaccines coming on stream as well. Parents are concerned now about overloading their infants. When you think about it, more and more vaccines are necessarily added to the schedule, but I'm not sure of the timeline, but maybe 10, 15, 20 years ago, there was a 4-in-1, and then it was a 5-in-1, and now it's in a 6-in-1. So parents are concerned about overloading their infants and the number of vaccines, as well as the number of actual injections their children are getting. And the focus on vaccines and their safety during the COVID-19 pandemic has both had good and bad effects on vaccine confidence. Vaccine take in Ireland for all childhood vaccines remains below the WHO 95% target at the moment, and some well below. MMR vaccination rates have fallen in Ireland over the last few years. I think the current figures for 2020 in Ireland, the first dose of MMR received at 12 months. In 2020, the uptake rate was 92%, but I believe in 2021 it fell to 90%, sorry. And then in the school year 2019-2020, the MMR2 rates were at 91%, and the most recent figures available for 2020-2021 were that it fell to 88%. So that's, as I mentioned before, there's a 95% uptake required for measles control, so that's quite concerning. In a recent national study in 2021 of parents' attitudes to childhood vaccines in Ireland, 96% of parents and guardians had intended to have their child fully vaccinated. So you can see how that hasn't fully played out, that though 96% intended to have their children vaccinated, the real life rates were just a little bit lower than that. A vaccine hesitancy rate of 7% was observed. 1 in 10 respondents reported that everyday stresses prevented them from getting their child vaccinated. So that goes back to the 3 C's and the convenience one in particular. Encouragingly, though, in this study, overall rates of vaccine hesitancy were low. and most parents retain trust in healthcare workers and in official HSE information, so they remain good channels through which to promote vaccines. The internet has a bit to answer for, so vaccine hesitancy on the internet. Even back in as far as 2002, nearly at the dawn of time in terms of the internet, wide use of the internet, academics were warning about the effects of the internet on vaccine hesitancy. So this is just another quote from a paper warning about the effects. The anti-vaccination message on the internet is far more unbridled than in other media. The internet represents a greater potential for the public to make uninformed decisions about vaccination. And that's way before most of the social media channels that we have now were introduced. However, the internet can also be a force for good, to tackle misinformation and to disseminate accurate scientific information. But it can be very challenging to compete with the vocal anti-vaccination movement, and they have to be actively tackled. Just to look a little bit closer at the timeline of the internet and vaccine hesitancy, so over the last 2 to 3 decades. So back in the 1990s, there were concerns about thimerosal and a link to autism in vaccines. And this was removed from childhood vaccines, but that link was never confirmed. And also in the late 90s, as I mentioned, the Wakefield paper on the MMR and autism was published, which had a huge effect on vaccine confidence. That was obviously later debunked, but created many problems for the MMR and other vaccines and vaccine confidence in general. And Andrew Wakefield is still out there. He's in America now, spreading vaccine misinformation. And then alongside this, just after those events, Google was established in '98, as I mentioned, then Facebook, YouTube, Twitter, WhatsApp, Instagram, Snapchat, Telegram, TikTok, shows my ignorance, and I'm sure many other channels that I'm not aware of, all places to share information, but also misinformation. Alongside this, lots of new vaccines came on stream. So sort of vaccine introduction to the schedules accelerated. There's the HPV vaccine, then the H1N1 swine flu pandemic in 2009. Alongside this, vaccines added to the routine childhood immunization schedule, and then obviously COVID-19 vaccines as well there recently. The recent challenges to vaccine confidence include the MMR and autism, an example of the effects of bad science. H1N1, the swine flu, one of the original vaccines, had a small but significant association with narcolepsy in Northern Europe. This was multifactorial and it involved genetic predisposition as well. And this vaccine is no longer used. However, I do mention it to highlight that sometimes people have justifiable concerns and that these should be acknowledged and investigated and a good explanation given rather than dismissed, as this approach will be unsuccessful and wrong to dismiss those concerns. HPV then, we would all have been aware of the well-organised lobby groups that spread misinformation about the HPV vaccine. They were very well organised and lobbied all the right people, so know who you're up against. The COVID-19 vaccine, more vaccine skeptics emerged online, and there was an initial glut of conspiracy theories around that. But COVID-19 has also been a success for vaccine confidence in some ways and for some people, as many people will acknowledge that the vaccine helps us to get our lives back. And the pandemic also highlighted the importance of human behaviour in controlling infectious diseases, and that's a useful thing to have highlighted. Just a success story in terms of HPV in Ireland, a vaccine hesitancy reversal story. So initially, the HPV vaccine in Ireland had an uptake of over 80% when it was introduced. It was lauded globally, I believe, and I think it was one of the highest in the world. It was as high as 86.9% in 2014-2015. However, parental concerns arose in relation to vaccine safety based on information spread by lobby groups. And this misinformation spread was a well-organised and far-reaching group. And as I mentioned, even politicians in the mainstream media were lobbied. It resulted in a documentary being aired on national television, and this happened in other countries as well, I think, in relation to the safety concerns around the vaccine. And so confidence in the vaccine was really dented, and uptake of the first dose fell as low as 50%. So a drop from 86.9% to 50% in 2016-2017. So something needed to be done to reverse this. A steering group of concerned organisations was convened, and a strong and coordinated response was initiated. Focus groups with parents were arranged to identify concerns, and all relevant stakeholders in education, parenting, politics, and other interested groups were consulted. An analysis of social media content was conducted, and online training materials were reviewed. Training was delivered to healthcare professionals. All this resulted in an increase from 50% back up to 61.7% in 2016-2017. But the reversal in hesitancy cannot be mentioned without mentioning Laura Brennan's selfless and heroic advocacy on HPV vaccination. She was also instrumental in turning this tide of hesitancy. And the latest figures for uptake of the HPV first dose in Ireland are 78.4% in the 2021-2022 academic year. So that's a real success story, and you can read a paper prepared for some of the staff in the NIO on that. I'll give you more information on that towards the end of the presentation. Just to briefly discuss my paper on COVID-19 vaccine hesitancy and resistance amongst parents of children under the age of 18 in Ireland. So as I mentioned, this was from a couple of years back, so the data is from 2021. So just to be aware that things might have changed a bit since then. So as we know, COVID-19 vaccines are now available in Ireland for children aged 6 months plus. And to maximise uptake, it is essential to understand how to communicate with parents. An understanding of their backgrounds, beliefs and concerns related to COVID-19 vaccines is required, and this is obviously essential for the promotion of all vaccines, not just COVID-19. Currently, we know that vaccine hesitancy has been increasing globally, even predating the COVID-19 pandemic. And internationally, parental COVID-19 vaccine acceptance rates vary widely. Common factors that impact COVID-19 vaccine hesitancy include younger parental age, lower income and education, female sex, safety and efficacy concerns in children, the rapidity of vaccine development, political influences. But it's important to note that these studies were carried out early on in the pandemic, before vaccines were approved. So these factors could have changed since then, but many of them remain relevant. For this project, my aim was to determine the levels of COVID-19 vaccine acceptance, hesitancy and resistance amongst parents of children under 18 in the Republic of Ireland for their children. Just to note that in this study, acceptance is those who completely accepted COVID-19 vaccine, hesitancy those who said maybe, they weren't sure, and resistance is those who said outright no to the vaccine. The aims of the project were to identify the predictors of COVID-19 vaccine hesitancy and resistance amongst parents of children under 18, and to inform communication campaigns. Data for the study were taken from the COVID-19 Psychological Research Consortium study, which was a study conducted by Maynooth, Trinity, Ulster University, Sheffield, and a university in Spain as well. The Irish sample was a nationally representative sample based on quota sampling. Funding was from the HRB and the Irish Research Council, and ethical approval was from Maynooth University. In the study, there were 482 people who had children under the age of 18, and they were the group that I was interested in as the participants of this study. So a reasonably small group, that's one of the limitations of the study. But the question I was interested in that was put to these participants was, multiple vaccines for COVID-19 have now been developed. Will you give your child a vaccine for COVID-19 when it becomes available? Those who said yes, or very, very small number who said my child had already been vaccinated, as remember this was spring 2021, were deemed as vaccine accepting. Those who said maybe were deemed as vaccine hesitant, and those who said no were deemed as vaccine resistant. I also looked at the impact of socio-demographic factors, health and COVID-19 related factors, and variables assessing trust and belief relating to COVID-19 vaccines. So how those factors influenced how people answered the question about getting the COVID-19 vaccine for their children. I used SPSS, and my main statistical test was logistic regression. Of the 482 parents or guardians, 52% said that they would accept a vaccine, a COVID-19 vaccine for their children. 30% were hesitant, saying maybe, and 18% were resistant, saying no, they definitely would not. I compared the group. So when comparing the hesitant group with those who would accept the vaccine, those who were hesitant, who said maybe, were younger, they were less well educated, they were less well off, and strangely, they were more likely to have had someone close to them sick with COVID-19. They were also more likely to believe that the vaccines were unsafe, due particularly to their rapid development. They believed that the vaccines can damage fertility, and that scientists and healthcare workers often cover up their mistakes. The resistant group, for those who outright said no, they would not accept the vaccine for their children. When compared with the accepting group, they were younger, they were more likely to live alone, they were less likely to trust in scientists, and also similar to the hesitant group, they were more likely to believe that the vaccines were not safe due to their rapid development and that they could damage fertility. These are, I say, non-significant findings here. These are not statistically significant, but I think they're very significant, meaning very important findings. That the belief in some popular conspiracy theories was not statistically significant or not significantly correlated with increased hesitance or resistance. So at the time, anyway, when I was conducting this study, the popular narrative in the mainstream media, I think, in my opinion anyway, was that those who were vaccine hesitant or resistant about COVID-19 vaccines were conspiracy theorists, and believed, and were all sorts of fringe elements believing in strange theories. But I tested this in this study, and I looked at a few different data points were available, such as that the vaccine gives you COVID-19, that the vaccine can alter your DNA, or that the vaccine contains a microchip. None of these were statistically significant reasons for anyone being vaccine hesitant or even vaccine resistant. So most of the reasons for people being hesitant or resistant were kind of more understandable reasons, such as concerns about the safety and efficacy of vaccines, rather than any of those fringe conspiracy theories. The limitations of the study, I mentioned the size, but also one big limitation, I think, is that the age, it was not broken down by age group. So I looked, this is all that was available in the data, but we looked at all children, parents of all children under the age of 18. But I think it would have been interesting if we could have broken it up into children between 12 and 18, between 5 and 11, and under 5, because I think it would be quite, there'd be quite a gradient across the age groups of vaccine acceptance by parents with the different age groups. And I think we're seeing that playing out in real life anyway, that the older age groups were more likely to be vaccinated, the teenagers, rather than the younger children. The conclusions and implications really mostly relate messaging. So the younger, less well-off and less well-educated parents are a target group for communications. The messaging should be clear, concise, and jargon-free, as with all vaccines, and should focus on the safety profile of vaccines, outlining how they were developed without compromising safety, they were developed rapidly without compromising safety, and addressing any concerns, but not focusing on debunking non-scientific conspiracy theories. I think other research has found that actually trying to debunk these non-scientific conspiracy theories can actually give them more airtime or increase them in a way. And the message should be delivered. It's more important how the messages are delivered and by whom. But it might need to be different for the vaccine resistant group compared to the hesitant group, because the resistant group trust even less in scientists. So the vaccine resistant group, it might not be as useful to have kind of prominent scientists coming out and trying to persuade them to be vaccinated. They might be better targeted by trusted peers, community leaders, maybe online parenting groups, influencers, etc. One big point is not to get into a fight with those who are vaccine resistant. That doesn't work. And have a look at the HSE-LAN module on talking about immunisation to see some great points on how to talk to people who are hesitant and resistant. What can I do? Well, people trust healthcare workers. Vaccine decisions are based on many factors, including emotional. The way we talk to patients matters, and the messages we deliver matter. How you say it matters as much as what you say. And clear, concise, easy to understand information with no jargon is important. Address genuine concerns and consider using motivational interviewing techniques, which are recommended by the WHO. Other methods proven to help increase uptake include reminding people about vaccination, making appointment times and locations convenient and accessible, and taking opportunities, so be opportunistic about recommending vaccines, even at appointments that aren't related to vaccination. Motivational interviewing is covered in more detail in the HSE-LAN course talking about immunisation. I think Cría is going to direct you, who's going to speak after me, is going to direct you a little bit more to the HSE-LAN courses, but in HSE-LAN under the NIO banner, the talking about immunisation course is particularly important here. It's a lovely little course, it's about 45 minutes long, but it's very practical and helpful. the WHO recommend motivational interviewing for tackling vaccine hesitancy. I'm not going to go into all these different aspects of motivational interviewing. There's just a brief summary on my slide here that I'm not going to go into, but it's all on the HSE land course. Motivational interviewing techniques can be used for short interventions. It might seem a bit daunting, but it actually doesn't have to be a long conversation. And they're quite easy to use once you inform yourself about them. Also in that talking about immunisation module are useful scenarios and tricky questions you may get asked by those who are hesitant and resistant. Further resources, I have listed them, but for those listening back, I'm going to just mention a couple of quick reads that I think might be of interest. I mentioned before the vaccine hesitant moment in the New England Journal of Medicine. You can search for this. The author is Larson, L-A-R-S-O-N, and the year is 2022. It's a quick read, I'd say 5 to 10 minutes, and it's very interesting, I think, and very relevant. And then also another nice quick read, the lead author is Corcoran, the rapid response to HPV vaccination crisis in Ireland. I believe at least one or maybe two of the other authors are on this webinar. And that's published in The Lancet and published in 2018. So you can search for that as well. And I like a couple of little videos on YouTube that provide some light relief on vaccination and that might encourage vaccination and maybe highlight the importance of appealing to people's emotions. So if you happen to come across the Marsh family videos from the pandemic, they do musical parodies of various different aspects of lockdown and things. But they have one on the COVID vaccine from 2 years ago, and it's called Have the New Jab, to the tune of Hallelujah. So you can search for that on YouTube. I think that's a nice video. And also recommended to me by a previous mentor is the vaccine song from 12 years ago on YouTube, and it's by Brain Warm Ups, but it's quite entertaining, but also kind of poignant as well. I think that's worth looking up. I have my references here and they're available on request. And thanks very much for listening, and good luck in your work helping us to promote vaccinations. So I'll just move on to the next speaker. I think Cría's up next to talk to you about communication.
Thanks very much, Ruth. Hello, everyone. My name is Cría Dowling. I'm a communications officer at the NIO, and today I'm going to be talking to you about communicating with the public and healthcare professionals about vaccines. So today I'll cover what we do in the NIO, some of our traditional and our digital channels for communicating, so the channels that we use in the tactics, and how you can help as health and care professionals. So what does the NIO do? We're responsible for managing vaccine procurement and distribution, and also developing the training communication materials for the public and health professionals of all our national immunisation programmes in line with the Department of Health immunisation policy. So our channels, beginning now with our traditional channels. So first off is the printed materials to support you and your patients. For example, your child's immunisations, a guide for parents. We have the immunisation passports. We have posters, we have stickers for your patients, and we also have post-vaccination advice. We have editorials and journals covering a wide range of immunisation topics, from vaccine ingredients to catch-up vaccination for children, and also the winter vaccinations, so COVID and flu and pneumococcal. So a mix of both traditional and digital with the press and media coverage. So we get coverage in the printed press and also online on websites such as everymum.ie, trying to get the message out there about vaccines and some of our vaccine campaigns. In terms of our digital channels, as Ruth mentioned, we have our e-learning on HSE land. So we have a wide range of e-learning programs available on HSE land. And if you register an account or log into your existing account, and you go into courses on HSE land, then select catalogue, select clinical skills, and then National Immunisation Office. In there, within that folder, you'll find all our immunisation programs, including that one that Ruth mentioned today, talking about immunisation, talking about vaccines. You'll also find our other HSE land programs, our COVID-19 vaccination program, flu, and also storing and managing vaccines. In terms of our digital channels, and primarily then our social media, we have a number of different channels. Some of you might be familiar with, beginning then with our Twitter and Instagram at HSCIM. We also have our YouTube, our LinkedIn, our Spotify, which this webinar will be available on to listen back to later in the week, and also our website, immunisation.ie. So I'm going to go through each of these in a little bit more detail now. So beginning with our website, immunisation.ie, this is updated regularly, and it's there to support parents and people getting vaccinated, and also health and care professionals, with information and resources so you can guide your patients to make informed decisions about vaccination. It's also worth mentioning that it's accredited by the WHO Vaccine Safety Network. So it's a trusted source of vaccine information in Ireland and about our national immunisation programmes. Just to highlight then that on our website, we have information for both members of the public and also the health and care workers. So for example, if you go into public information, you'll find information on all different immunisation programs that we have, and for example, the vaccines for babies, just highlighted. And also then just to highlight then on our website, we've in the healthcare worker information section, there's also a range of information and resources available to support the national immunisation programs. So as mentioned, we have a range of different resources and information materials, and for health and care workers specifically, we have toolkits that we've developed. For instance, for GP practices and pharmacies. We also have social media toolkits available, tips and tricks on promoting vaccine uptake in your practice or in your pharmacy or in your clinic. And it's also just worth highlighting that this week is European Immunisation Week. And we have a range of materials available, and somebody that will have a campaign pack as well that will issue to all attendees after this webinar if you've registered. Just for those listening back, including this, including a poster that's available to download and print off locally. That's on our website, and it's about the facts and vaccine facts. And as Ruth mentioned, it's really important to focus less on debunking myths and more about the facts and making sure people have the information to support and guide them on that decision-making process about journey on vaccination. So once again, yeah, highlighting the facts about vaccines. And just as I mentioned there, our toolkits that are available and our campaign packs, all on immunisation.ie, our website. It's also worth mentioning our website for HPV, so hpv.ie, and here you'll find information about the HPV catch-up programme, and also the programme in schools, and a range of materials and resources for both, as I mentioned, members of the public and also you as health and care professionals. Moving then on to our social media channels. So beginning with Twitter and Instagram, these are channels that really give us the opportunity to share the facts, as I mentioned, also to share campaign updates. So this week in particular, we're focusing on European Immunisation Week and with the campaign Every Dose Counts, highlighting just how important it is for children to catch up on any vaccines that they may have missed due to the COVID-19 pandemic, and also just highlighting the importance of timely routine vaccination, especially for children, but also for all members of the population too. It's also an opportunity in the channel for us to point to any new resources that we developed, any clinical updates on our programs, and to highlight your work too as vaccine heroes. And just to mention, if you're not already following us on Twitter, Instagram, our handle on both platforms is at HSCIM, so HSEIMM. We also have our YouTube and our Spotify channel. Once again, this is an opportunity and a platform to provide clinical skill updates. For example, we have a video on landmarking and administration of vaccines, a demonstration video on our YouTube channel. In YouTube in particular, we can share campaign animations, and these might be helpful for explaining with your patients about vaccines. And also there's helpful animations on the cold chain delivery service too. We have our presentations, including our Lunch and Learn webinars on both YouTube and Spotify, YouTube to watch back and Spotify to listen back to as a podcast. And yeah, they're both channels that give us that a platform to share our Lunch and Learn webinars to make them more accessible for people who may not be able to tune in live. And once again, just to mention, if you're not already following us on YouTube or Spotify, you can find us by searching National Immunisation Office on both channels. And lastly, then our LinkedIn channel. So this is an opportunity similar to the other channels to provide campaign updates. So across all our channels this week, we'll be posting a lot about European Immunisation Week. So we ask you to keep an eye out, and we love if you could support us on our channels by sharing or resharing our messages. It really helps amplify the message in the campaign. On our LinkedIn platform, we can also point to new resources. And once again, any updates, any clinical updates, any of the programs, and specifically then to LinkedIn, we can highlight any job vacancies as well. And our handle on LinkedIn is HSC National Immunisation Office. And if you search that in the search bar, you should be able to find us. So how can you help? By keeping up to date with our resources and our programs. A really handy resource that we have is our immunisation bulletins, and we post them or we publish them quite frequently, at least once a month, and sometimes more regular if there's an important update that we need to disseminate information on. And by also you can help by helping us spread the facts. So as I said, resharing or sharing our content, our messaging, and we have a range of information materials, but also campaign assets that you can use for your own social media campaigns. And we highly encourage you to go on our website and download them. And for Immunisation Week in particular, those assets will be made available to all attendees after the webinar in our campaign pack. To use the recommended techniques that Ruth mentioned in her presentation earlier, when dealing with patients and any queries or concerns that they may have about vaccines, and also to just visit our website regularly for any updates and keep an eye on our social media channels.